turn our attention now to Tanzania, where the government there has explained the recent spread of flu, headaches, and fevers that have triggered fears of the advent of the fourth wave of COVID-19 in the country. Now, this comes at a time when an increasing number of countries around the world are detecting more cases of the new variant Omicron. CGTN's Isaac Lucando has more.
The Tanzanian government says a recent rise in flu and fever cases in the country is not coronavirus related. It's urging the public to be calm as doctors in the country report treating such patients over the last 2 weeks. Officials have instead attributed the recent spike in cases to weather changes. Tanzania is yet to release the latest COVID-19 figures, but the country's prime minister insists that there are no cases of the latest variant, Omicron.
The Ministry of Health should explain this. A fourth wave has not entered Tanzania, and we do not have a single Omicron patient. Many people pass through here since we have an international airport, but it's just not the case.
Despite not having a single case of the new variant, the government says it is monitoring the situation closely. With only 2% of Tanzanians vaccinated against COVID-19, some doctors believe this may be contributing to rising alarm among members of the public. The situation is complicated further by recent reports that suggest many Tanzanians are relaxed about seeking medical attention when it comes to COVID-19. With cases of the latest COVID-19 variant rising around the world, the government here is urging the public to be vigilant. According to official figures, Tanzania has had around 26,000 infections and 734 coronavirus-related deaths reported in the country since the COVID-19 pandemic began. Isaac Lucando, CGTN, Dar es Salaam.
I'm Dr. Das. Past 1 week, we have been seeing a surge of lots of patients with a throat infection. So many people are actually thinking that exactly what it is. There are speculation. People are sending messages like, is it a new variant of corona, or it's a bacterial infection, or is it some kind of other infection or viral infection. So from past 1 week, we have been seeing lots of patients with a throat infection. And this is not just one kind, it's a mixed type of infection. Some of them has viral, some of them has bacterial. If you get this kind of infection, come as soon as possible to the clinic, see your doctor, because if you start the medication early, then the symptoms will go down and spreading in your family member also going to stop. Do not take any antibiotic. Most of the patients, when they come to see us, they have already taken azithromycin or amoxicillin. So don't take any antibiotic over the counter. It really becomes very hard for us to diagnose and give you proper medication, because then the medication does not work. If you want to take, you can take some antihistamines, anti-allergy like cetirizine, loratadine. This will reduce the throat irritation. And for fever, you can take paracetamol. I hope that things will go down very soon, but take care of yourself. If you know anybody suffering, tell them to go see a doctor as soon as possible.